Hi everybody, it's Krista. I'm going to go over my 10 x-rays really quick and let me know if you have any different findings than what I have. For the first one we have is the AP position. Inspiration is adequate. You could see the 8 posterior ribs. Exposure is good. I can see the vertebra through the heart. The airway is midline and patent. We have it drawn all the way to the carina here. The bony structures. So I labeled most of the significant bony structures. However, I also noticed that there could be some possible rib fractures down here. Again, this could just be some sort of artifact. However, these didn't seem to line up too well with each other. Diaphragm, we can see the right and left costophrenic angles. I'm curious to know if there's a bit of fluid in here. It seems a little bit translucent. However, that just could be because of the positioning of the x-ray. The heart looks enlarged, like if there's a little bit of cardiomegaly. Like this could be, again, fluid just because of this really grainy appearance that it gives off. So I'm kind of thinking some sort of maybe a pericardial infusion, secondary to the trauma that we have here. Gastric bubble, lower left quadrant. The lung fields, you could see the lines, the vasculature of the lung fields all the way up, going upwards against gravity. I just made note of that. Doesn't appear that there's any invasive lines that I can see. Let's see. And my abnormalities, like I said, there's cardiomegaly and a possible pericardial infusion, maybe a little bit of pleural effusion at the bases. Second position, PA upright. The inspiration is adequate. You can see about 7 ribs. Exposure is good. The vertebra is visible through the heart. Bony structures, I just wanted to make sure, I didn't label every single picture, but I just wanted to make sure that this was center through the 2 clavicles. It is. The airway is midline, patent. Diaphragm, you can see right and left costophrenic angles. These ones look pretty good. You can kind of see the heart through the shadow here. It goes down and here. I was curious if there's right and left effusions. Again, this just could be the shadows of the ribs, which it probably is, but made note of it. And the hilum present on both. Next one, PA position. Inspiration, I would consider the inspiration inadequate, but that's secondary to the condition that this patient is experiencing. The airway is clear. It's not exactly midline. It could be because of the infiltrates that the bronchioles have on this side, and the hilum is causing this enlargement, and it's deviating that trachea to the side. You can't distinguish the diaphragm. You can kind of take an estimate of where it might be. There's a lot of consolidation is what I figured it to be. You could see the outline of the heart and maybe some fluid accumulating around it. Definitely has a history of cardiac surgery. And so we could see the one in purple, and then the sutures over her midline. And then I just made note of a few of the vasculature structures that looked notable, especially for her cardiomegaly that she also seems to be having just because of the shadows that it gives off. And I also did note that the carina does seem to be pretty obtuse, and so I'm not sure if that is indicative of the left atrial enlargement. Next one, AP position, inspiration. It's adequate for what I would see that this patient is experiencing. Inspiration, obviously there's no inspiration occurring on the left side. The airway, we have a right tracheal deviation because of the pneumothorax. Diaphragm, you cannot see the diaphragm on the left side, you could see it on the right side. Again, there's this shadow here, looks kind of like maybe there's some sort of pericardial infusion. I don't know if there's a difference between these lines here, which again are called curly B lines, which are the levels of a fluid, I believe. There's air bronchograms in the lungs here, so the bronchioles are holding onto that air, and it increases the lucency of the X-ray. Gastric bubble, lower left. Hilum, you can see, make it out at least somewhat on this right side. The vasculature is pretty apparent, especially when going up. Left, I think you could kind of make out this side, but you could just see that there's maybe some underlying structures going on there. Let's see. Next one, AP position. Again, cardiomegaly. You can see the outline. There is poor inspiration. I feel like the exposure was adequate, but again, the inspiration is secondary to the condition. Airways, clear, midline, patent. Effusions, looks like there's bilateral fluid accumulation from what I can tell. We have this here and this here, and you can't really make it out too much on the left side. And the cardiothoracic ratio is greater than 50, so cardiomegaly. My differential would be that this person has a pericardial infusion secondary to congestive heart failure. Invasive lines, you could see that there's maybe a right chest tube, and then the EKG leads. For this one, AP inspiration is adequate. The exposure is adequate. The airway is midline. The bony structures, I outlined them here, so we can see that it's centered. Diaphragm, you can see the diaphragm. Both right and left costophrenic angles look good here. There's no effusions, but there are these nodules that have some well-defined edges. And this part of the heart here, the left border seems to be pushed down quite a bit, making it a little bit like caving into the diaphragm here. We have the gastric bubble. The hilum is larger on the right than on the left, and it doesn't seem like there is too great of a difference in height. Made note of that. This one here, AP, poor inspiration due to the condition. Exposure is adequate. Slightly overexposed, however, it seems like if there's a lot of subcutaneous tissue to this patient, and this is just kind of the exposure that we can obtain from this. The diaphragm we have here in pink. It's not well defined at all on either side. The cardiothoracic ratio is greater than 50%, so we have maybe some sort of cardiomegaly going on. Lung fields are obviously not clear. We have the hyperlucency bilaterally greater on the right than on the left. And we can see we can't make out the right or left hilum, but it looks like there is some sort of opacity in the way. Then we have the pacemaker, and I think this part here might be the ET tube. We have EKG leads going on, and then we also, I think, have a central line here, if I'm correcting all those lines correctly. And then we could see the oxygen and then the ET tube here that goes down. My differential for this one would maybe be some sort of lung cancer as carcinoma, Mets. This one, AP position, the inspiration is adequate, the exposure is sufficient, airway, midline, bony structures, I have the mount line, diaphragm, again, some sort of effusion, they're not quite clear, they're kind of muddy. I'm unable to see any gastric bubble. I think that might be because of the density of the tissue. The hyams, you can't make them out too well, but you can kind of see where that they are. They look about pretty equal to me, so I don't know if that there's some sort of pressure. But abnormalities to me, cardiomegaly, cephalization, the full hyam and the curly B lines, again, that we're trying to pick up on coming out. Pulmonary, so my differential would be pulmonary edema secondary to heart failure. This one, AP, poor inspiration to their condition, but adequate exposure from what I can tell. I think that, like I said, again, this person might have a lot of subcutaneous tissue. Airway, there is a slight deviation on this side. Looks like there's a lot of that interstitial pressure moving it over. Claustrophrenic angles are lost secondary to the consolidation that is in the lungs. So you can't see, you could hardly see the diaphragm. And you can kind of make out where it could be. So right and left effusions. Lung fields, I would say that there's right hemithorax. Gastric bubble. So this appears to me to be bowel and some sort of surgical dressing on top of it. The last one, PA position, adequate inspiration, exposure is adequate, airy, deviated to the right slightly, and the bony structures, everything is centered. Effusions, so I don't see any effusions, but I do see this area here. That is all air, and this patient looks like they might have some sort of emphysema. You have the tubular heart with like the pressure that's coming down onto the heart, kind of making it look like this. And then you have the diaphragm that's going to be higher on this side, but then lower on this side. You could also kind of see this this shadow here, which could mean that there's air. And this area here, if you have the pneumothorax, this is all air. And you can see the outline right there. And so the air would be able to go under the diaphragm. It's especially if this patient has emphysema. Gastric bubble. So if this could be that gastric bubble, however, I kind of believe that it might be a little bit of air that's gotten under the diaphragm here. And so that's air. Um, the hilum, they're bilaterally enlarged. It doesn't look like there's any invasive lines or procedures that this patient has had, other than maybe needing a chest tube or waiting to see if it spontaneously resolves. And the lungs are hyperinflated just because the measurement of volume of what it looks like it has. And the diffuse increased lucency of the lungs is what kind of brings me to kind of building a differential of that. And that is it. If you guys have any questions, let me know. Thank you.